this procedure, we are placing 4 implants in a dentulous site. Edentulous means you don't have teeth and the bone is ready and primed to place the implants. So this patient has a little bit more bleeding than we usually see, and that's due to some biologic factors that the patient has. But you can see that we go ahead and we make our initial osteotomy, or some people might call it a pilot hole in lay terms. And we make sure that we like our angles, that we're in the center of the bone, that our distance between implants and teeth is sufficient. And we'll go ahead and make those pilot holes and then go to the sequential drills until the hole is wide enough without disrupting the cells and the bone to place the implant. So one of the things you'll see is that there's lots of water, and the saline in the water cools the bone so that the bone doesn't overheat. If you overheat the bone can die and cause other complications such as failure of an implant. So you'll see lots of water and cooling of the bone, and then you'll see the implant placed at the end. So we're placing 4 implants. The bone in some areas is narrow, so we're using different sizes to account for the different width and depth of the bone in this case. And then you'll see me doing a continuous interlocking suture with PGA sutures, and that is going to allow for swelling. The way that those sutures are placed, it allows for a little bit of swelling without the sutures tearing. It's also a very clean suture, so it doesn't harbor bacteria like the old silk sutures did. And it's very strong as well. So some flexibility to allow for the swelling, but it still has that strength. So it's a really nice high quality suture. And then the technique that I'm using, it's continuous, so it goes all the way across and it's really just one thread.